If you're in what we would class as a dental desert, where recruitment's difficult, a therapist would be beneficial.
So it all comes down to, I guess, cost of sale.
Dental therapists are mainly perio-paediatric driven, and I say that's more where the profit is.
If you benefit from a strong UDA rate, upwards of £32, it could be consideration.
Yeah.
Hi there, welcome to this water cooler with Julie Randle. So Julie, welcome.
Thank you, Phil.
We're talking about NHS therapists and the increasing NHS therapy model, and really whether that's worth it from a practice level. So Julie, what's your views on the therapy model?
It depends where you're located. If you're in what we would class as a dental desert, where recruitment's difficult, a therapist would be beneficial. But typically what we're finding is when we value practices, we're not valuing a lot of practices with a dental therapist doing the UDAs, which is typically because a dental therapist's hourly rate is between £30 to £40. They will need nurse support, so chairside support, which takes that to maybe £55. If they're doing 4 UDAs, then yes, it's worth it. It's worth about £12 to £13 in line with an associate. But if they're only doing 2 UDAs, then actually that doesn't become very profitable.
So it all comes down to, I guess, cost of sale.
Exactly.
Calculating their cost of sale, their effective UDA value, how much is being delivered within the practice, and also are you losing out on potentially private therapy or hygiene hours, which typically, if you've got a really strong private book, you could be missing out some great profits.
Exactly, and what we're finding is dental therapists are mainly perio-paediatric driven, and I say that's more where the profit is.
But of course, in dental deserts, if you can't find an associate and you've got a large contract, then utilising a therapist could be a way forward if you can recruit.
Yes, certainly something to look at if the numbers stack up.
Okay, so there you go. Dental therapists, I guess it's a question mark depending on the independent practice. I guess a big thing is the UDA rate. You know, if you benefit from a strong UDA rate, upwards of £32, it could be consideration. If you've got a low UDA rate and the therapist has a low UDA output from that hourly performance, then it may be something to really look into as whether that's a viable option to sustain that NHS contract. And maybe the question should be, should we look at the NHS contract, which is another water cooler, I think, in which Anil is going to pick up. So look out for that water cooler. Julie, thank you very much, and thank you everybody for listening.